turned on, so I'm glad we passed that. Well, hi everyone. My name is Alissa. I'm the AVP for Marketing and University Relations at USD. I know most of you probably know the gentleman sitting next to me, but I'm going to have them each introduce themselves and their roles just for anyone who's unfamiliar.
Hi, I'm John Dudley. I'm the Dean of the College of Arts and Sciences. I'm a member of Rotary, so I'm here not every week, but I try to be here more than occasionally. So good to see everybody.
I'm Bill Mayhan. I'm the Dean of the Biomedical Sciences at the Medical School.
I'm Kurt Hackemer. I'm the University Provost, and I'm also oversee academic affairs, which is everything that's not health affairs.
Great. So I am going to kind of moderate our discussion today. When we were talking to Deb about this session, it was really important to us that we used our time together with you here today to answer questions on your mind. We didn't want to come and have a 4-page script that we just read through. We really wanted to answer and address the topics that you all are thinking about. And so, Deb, thanks so much for helping to solicit those questions or feedback from this group, and thanks to all of you for contributing. We'll go through this, and then there should be time at the end if there's any additional questions that you want to ask. So when I was reading through the feedback that Deb had shared about sort of the topics or themes of interest, they really broke into 3 categories, including facilities updates, program expansion, Lee Med building, Akeley Lawrence, and then of course our new site in Sioux Falls. There were questions about research, both undergrad and biomedical and translational sciences. And then there were questions about kind of interprofessional health education in general. Additionally, there were a handful of questions that fit into a 4th category, kind of a catch-all that I'm more or less referring to as how did we get here? These are questions like, how will this move impact a medical student's application project or process, or why weren't there community forums held before this move like they were for the law school? And so that's the section I want to start with. I want to provide just some kind of basic framing information, and then we'll jump into the other categories. I'll take the lead on this one, but if there's anything I miss, please jump in. So what factors contributed to the decision to move Pillar 1 of the medical education journey and student affairs from Vermillion up to Sioux Falls? Well, I want to start here by emphasizing that our charge at USD is really to provide the best possible experience we can for our students. The Sioux Falls transition for the medical school has been on the table for decades. I think 30 years was referenced at the Board of Regents meeting earlier this month. And really, this is because of the nature of the medical school experience and the fact that it is so tremendously different from any other program that we have at USD. The med student, sorry, I've got just a couple slides. The med student journey is broken into 3 pillars. The only pillar that is in Vermillion is Pillar 1. This pillar starts in July and lasts about 18 months. During this pillar, students still have to spend a couple days a week in Sioux Falls, where they have access to clinical partners and other education experiences. And so this, the med student journey is really the only program that we have that requires that commuting, right? It's built into. That's not true of undergraduate programs. It's not true of the law school. It's really unique. And so this opportunity to sort of remove that commuting experience, to be able to have more access to the healthcare systems in Sioux Falls and other partners, it is really what drove this conversation. The other thing I want to emphasize is that each medical student or each med school class is really only about 70 students. And so we're not talking about hundreds and hundreds of students. We're talking about a very small group that is already spending, frankly, half of their time in Sioux Falls as is. It was a combination of understanding that this would improve the experience and then having support from healthcare partners, state leaders, of course the students, faculty, staff. That is really what led us to make this announcement and pursue this move. The next question here that I have is please comment on why, and I'm reading these verbatim, please comment on why community forums such as this one were not held before the decision was made to relocate. This is a good question. It's a fair question. I suspect many of you were around, and maybe some of you even participated in some of the forums or discussions when the law school move was on the table 10 years ago. As I said, this conversation, really unlike the law school, and I should also take a step back for those of you who don't remember, the conversation or the opportunity to move the law school from Vermillion to Sioux Falls was really driven by a couple things. It was driven by bar passage rates, it was driven by declining enrollment, and it was a good opportunity to bring people together to kind of discuss. This situation, very, very different. This move wouldn't have been one that would have been swayed by public opinion, first and foremost. It was really a decision that was made, again, in the best interest of the students and kind of following support from our healthcare partners and other stakeholders. But it's a fair question, and I appreciate it being asked. So then my last question in this category is, what is the timeline and how will this impact both prospective medical students and faculty? So starting with the prospective medical students. So as was announced earlier this summer, we intend to be fully transitioned for Pillar 1 by the summer of 2028. So if you are starting your medical student, if you're starting your journey this summer, nothing will change. You will do all of Pillar 1 in Vermillion, and then you will move up to Sioux Falls for Pillar 2 and the rest. If you are starting next summer, you will begin in Vermillion and you will transition to Sioux Falls for like the final 5, 6, 7 months of your Pillar 1 education. And then if you are beginning med school in 2028, you will start in Sioux Falls. As far as how are we supporting faculty staff, School of Medicine faculty staff who work with Pillar 1 students will have a little bit of a transition period. During that time, USD will support these faculty by helping with commuting to Sioux Falls. We're also having conversations in some instances about hybrid work environments, really taking this on an individual basis and trying to provide as much support, as many resources as possible. The transition for basic biomedical and translational sciences will take a little bit extra time. We've actually, and I'll defer to Dr. Mayhan if he wants to share more information here, but we've actually engaged a consultant to sort of help guide the BATS transition process, and we'll, again, work closely both with that consultant and with the new BATS dean later this year to provide, again, that support, those resources for those faculty and staff who will be impacted by this transition. So that brings me to the end of the sort of how did we get here section. Is there anything I missed from this group that you'd like to add? Okay, sounds good. So then we'll move into facilities and program expansion. The first question that we received here is what will happen to the old building? And for this question, I'm going to defer to Dr. Hackemer and Dean Dudley.
So there's been a parallel discussion outside of the medical school for a couple of years now about the nature of research at USD and how it's changing and how we needed to adapt to it. We think about AI with all the generative AI stuff from the last 3 years. AI, there's actually several different versions of it. One of them is called machine learning, which is the processing of massive data sets. And we've had researchers who have moved increasingly into that area over time. And we have started talking about ways that we could create an interdisciplinary environment for data sciences, which is happening in multiple disciplines. To the point where prior to the announcement of this move, we had conversations well underway about the need to build a new building on campus that we would have creatively called the Interdisciplinary Data Sciences Building. And the idea there was that we were thinking about co-locating all of these disciplines into a new space to make collaboration more possible, more likely. And that's actually a pretty common concept that you see across the country right now. This was also driven by the fact we've been renovating like crazy on campus, obviously. $85 million in academic building renovations in the last 6 years alone. But one of our problem buildings, the building that we knew we couldn't save, was Akeley Lawrence. There are sort of fundamental structural issues with the foundation in Akeley Lawrence, and so we knew we were going to have to move people out of that as well. And so our mindset, and this would be John and I talking with others, was what's a new building going to look like? What would it have to, how much would it cost? About $40 million or so. So when our conversation about what to do with data intersected with the med school move, now what we've got is a facility in Lee Med. The half that will be vacated is almost exactly the square footage that we would need for an interdisciplinary data sciences building. So that will allow us to take Akeley Lawrence down and then start migrating departments over into that space. That will free up some other spaces on campus, for example, where we can move the geological survey, where we might be able to expand some other student services. But really, this has dovetailed really quite nicely, and over time will save us a lot of money. We can, the cost of renovating the med school to better serve the needs of interdisciplinary data sciences is so much cheaper than having to build a new building. I'll let John pick that up.
Thanks. Yeah, I think, and for us, so what we're talking about, the current plan is to relocate several departments from around other parts of campus to what's the Lee Med building when it's the interdisciplinary science sort of cluster of departments. And that would be computer science, mathematical sciences, sustainability and environment, and then the biomedical engineering portion, their office on campus. They're based in Sioux Falls and will continue to be there, but most of their undergraduates are on campus. And right now they have a very small space in the basement of our arts and sciences building. Many of you know computer science is on the second floor of arts and sciences, not optimal for a growing field, a growing area. We're kind of out of space. Sustainability and environment is in Akeley Lawrence. They're really almost out of room. They just hired a new faculty member and we're scrambling to figure out exactly where that's going to be. And math and computer science are in very different places, but really are increasingly collaboratively involved in a new data science PhD program, for example. And what we're seeing is that data science, big data, machine learning, AI, all these things that are happening are really transforming not just the STEM disciplines, though that's where it's most noticeable, but also humanities and social science disciplines. And to have a space that's designed, that has in it a lab space, collaborative laboratory space that encourages some of the folks in these departments, both faculty and students, to work together on these projects. That's really, that would really help us move forward in those collaborations. Right? It doesn't seem like it's that much to walk across campus, but sometimes people don't bother doing that. Whereas if there's a space where people can get together and work on these projects. And many of the classrooms and the rooms that we have now are built for, 100 years ago how a classroom worked, not how a class really works now, where those boundaries between what's a laboratory space, what's a research space, and what's a teaching space are a lot more flexible. So I think having this and accelerating the timeline when we can have this instead of building a whole new building is certainly a big plus for arts and sciences, for our interaction with our faculty, both within our college and in the other units on campus. I could go on and on about that, but I think that's really a big benefit to us of this opportunity is to have a place where these departments can work, but also folks in the other departments, chemistry, psychology, English, you name it, are going to have work in data science projects that can be based out of this space. So I think that's hugely beneficial for us.
The next question here that was submitted is there already a building in Sioux Falls, or is one being built? I'll start with this one, and then Bill, if there's anything you want to add. So it was announced on April 2nd, following the Board of Regents meeting, that the new facility home for Pillar 1 and Student Affairs will actually be the Tally building. If you're familiar with the Sanford campus, the School of Medicine campus in Sioux Falls, the Tally building is immediately to the east of the existing campus. I think it's even connected by a skywalk. It's fitting that this building is named after the former dean of the medical school, and it is just really a great opportunity for us to utilize an existing space that is already connected to our campus. It's very, very cost effective. And this move really, it was never about like the building, right? It was never about building the Taj Mahal of medical education. It really was about promoting collaboration, access to industry, access to clinical experiences, and this building opportunity, frankly, gives us the ability to meet that objective much sooner than was originally planned. The other thing that I want to acknowledge is Avera has been a very equal partner in all of this. They are working to provide and to secure space on their campus, likely the McKinnon campus in Central Sioux Falls, that we can use for active learning or classroom spaces. Again, being so fully integrated into those hospital settings will just provide such a tremendous experience for these students. And it will also be a great resource for the clinical faculty that we have in both systems that are currently educating our students. Bill, anything?
I think the education space is going to be very important in the Tally building. So we'll go in and we'll gut that building, and we'll provide not normal type of lecture halls, but areas in which students can be involved with active learning. Active learning is a process where I don't stand in front of the students and lecture to them, but they provide them information to other students, and they really teach themselves. So it's a process that many medical schools across the country are using. We're currently going to other medical schools to see how they implement active learning, and we will have our faculty involved in designing the space for the students for this process. The research part of the move is to be determined. We're trying to identify space for research, and we're going to take our time in moving research up there. Again, we want the input from the faculty on how this space should be renovated or built. NIH, National Institutes of Health, has come out and said, we want to lessen animal research over the next 10 to 20 years. So we want to make sure that we're building space that we can use translational research in, so human subjects research. So we want to take our time in doing this to make sure that we're at the forefront of this translational, or this move to translational research.
Okay, so next, switching gears and moving into the research theme. The first question we received is, how will our undergraduates participate in medical research projects, which are really essential for med school admission?
I can say, I think I'll let Kurt add to this. That was my first question when this came up, was, okay, we need to make sure we retain that connection between and that's a lot of our students in the College of Arts and Sciences, pre-med and other pre-health professions, that's a key part of what we do, is provide those experiences to our undergraduates. We have Idea Fest going on today. If you walk through the Munster University Center, you'll see posters, and a lot of those are our students, and a lot of those experiences have come in working with medical school faculty and doing that research. So that's a priority for us to figure that out. We haven't figured all of that out yet, but we've talked about, for instance, many of the UDiscover grants, which are provided over the summer. In many cases, having those experiences in Sioux Falls will be beneficial to students, because that may be where they're spending their summers anyway. So that's an opportunity. And we need to figure out ways to make sure whether it's a shuttle bus, whether it's, figuring out a way to make sure our students can move back and forth easily and support them in doing that so that they can get those research experiences. I think that was the number one priority. Faculty research is also very important to us. That was sort of the next question. We want to maintain those collaborations and those opportunities. And I think we have a model for doing this now with biomedical engineering. Biomedical engineering is primarily based in Sioux Falls. That's where their laboratories are. That's where the research is happening. Almost 100% of their undergraduate students are in Vermillion on this campus, and they are figuring that out. Some of that happens with courses that are offered in 2 places at once with online modalities, and then getting those students to come up there, usually when they're juniors and seniors, to get those lab experiences. So we're going to be leaning on their experience to sort of learn how we can scale that up and make sure that we're providing that kind of opportunity to all of our students.
So we think that the move will open up opportunities that students will take advantage of that are in arts and sciences. We think that will happen. I've been here 10 years, and I've had 5 students in my lab for the summer, and 1 commuted from Scotland and the other 4 from Sioux Falls every day to work in the summer. So this will be better for the students who have a base in Sioux Falls or in that surrounding area. And wet lab experience is not always necessary. We have the SDBCC, South Dakota Biomedical Computation Consortium, which brings in AI and computation, and really those types of research projects during the school year can be done via Zoom or in collaboration with research faculty that may be in Sioux Falls. So we don't, I mean, undoubtedly there will be some hiccups with undergraduate research, but we think that the opportunities that open up and the other programs that open up will carry the load for those research projects and those opportunities.
So like John, this was the very first question that came to mind when the med school relocation came up. And in part, it's because of the really long and fruitful collaboration that we've had with the medical school over time. A lot of you will remember Royce Engstrom when he was here. This was something that Royce really pushed setting up and formalizing undergraduate research at USD, and it is one of the hallmarks of an undergraduate education here. So, yeah, I had some sweats right away too. What we've done to start is to try and understand exactly in a little more detail how undergraduate research currently works here. So, for example, we've done an inventory of our arts and sciences faculty, looking to see if there was any capacity for taking on additional undergraduate researchers. The answer is there's not right now. And we've also tried to quantify the amount of research that's being done by USD undergraduates in the School of Medicine, especially working through the honors program, how many faculty are involved, how many students are involved, like what is it that we're trying to replace, right? That's going to be an essential first step. The recent news about, as we've learned more about the actual timetable that's now taking shape for the move to Sioux Falls, gives us some breathing room. When I first heard this, I was thinking we're going to have to figure this out in a year or two. And now, when we think about it'll be first the teaching side of the medical education that's going to go to Sioux Falls, to be followed later by what's happening in biomedical and translational research, we actually probably have maybe closer to a 5-year window of time to figure this out. And just to be really blunt, we don't have the answers right now. It's something that we talk to Office of Research about quite a bit. We know we have to figure this out. We know that it is important to the kind of education that we offer here. We don't have the answers yet, but this is what USD does, and so it's going to have to be preserved and maintained perhaps creatively in some way. So very much on the front of our minds.
What effect on recruiting life scientists and other professionals will result from the move to Sioux Falls? Will there be duplication of facilities and staff between Vermillion and Sioux Falls? And Bill, I'll let you take.
So I think the move to Sioux Falls will really help us recruit scientists. We've had over the years that I've been here, we've had a handful of people that have turned us down about coming and joining us in Lee Med at the medical school for various reasons. And a lot of them are that the households they're too professional. So, and there aren't opportunities for the spouse or the significant other within the Vermillion area. So I think the move to Sioux Falls will help with that. I think that it will open up collaborations for us with Sanford Research and Avera, and that will be really important. Many of the people that we look at to hire have some sort of human subjects research base, and to be close to clinical faculty that they can get referrals for patients and talk to these individuals will really help our recruiting efforts. So I think this is a plus for us for recruiting.
And then lastly, what will be the effect on research grants with this move?
I think if we can recruit top-notch faculty here that are at the forefront of biomedical research, our grant dollars should go up. I think collaborating with Sanford Research and Avera will allow us to write CTR grants, which are Centers for Translational Research. And we've already been involved with Avera on a recent CTR that looks like it will be funded. And really that happened because we were in talks to do a move. And now we'll be closer to those faculty. We'll be able to work with the rural communities with research projects and bring in rural physicians and train them for our farm program that the medical students participate in, so they get exposure to research and the problems that are associated with rural health. So I think the opportunities for grant support will increase dramatically.
And I think also for arts and sciences, if BATS benefits from this, we benefit from this as well, because we have a lot of collaboration between our faculty and the faculty in the medical school on research, and we want to make sure that continues. And a lot of that was really based on personal interaction and connections rather than geography. I mean, it's nice that they're across the street, but for instance, when I meet with Bill, we're usually on Zoom anyway, even though we may be across the street at that moment, right? So a lot of this work is not happening, as Bill said, in a wet lab situation. A lot of this is happening, especially with the data science work that is involved in that biomedical collaborative. That work is happening in separate labs in separate places, but collaboratively between people who know each other and trust each other and work together. And so those collaborations are still incredibly important to us, and I think as the medical school gets new opportunities for research, expands their opportunities, that will help our faculty. And I also wanted to add, we've just hired 5 people this year, or we're in the process of hiring 5 faculty in interdisciplinary data science across different disciplines that are going to benefit from this, going back to the data science piece of this, that's going to, their presence and their expertise is going to further expand our research capacity, because every discipline now needs someone in that grant proposal who can manage those data projects. And now we're going to have 5 more people than we do right now doing that kind of thing. So that will also benefit us.
Okay, so the last kind of section that we had here was on health education in general. Question we received here, there's a few questions in this question, but the various USD health professional programs are noted for having certain basic courses taken together, including medical students, which encourages teamwork among various professionals in practice. Will the isolation of medical students for the basic sciences in Sioux Falls discourage the idea of healthcare teamwork? Good question, and I'll start here with just a quick clarification that our medical students don't take classes with undergraduates. We looked at the health education journey, the timelines, they don't even line up, right? All basic sciences are and will continue to be offered in Vermillion, and pre-med, the pre-med track will also continue to be offered exclusively in Vermillion. I think this question might refer to the IHEC, or the Interdisciplinary Health Education Center, which is not actually a physical location. It's really more of a concept. It's a learning experience that emphasizes collaboration, communication, teamwork across multidisciplinary in multidisciplinary education. It's also not limited to health professions only. The Sanford School of Medicine transition has no impact on that. And I also want to emphasize that our health affairs programming has existed in Sioux Falls along with Vermillion since the school, or since health affairs was started, some 20 years ago. We don't anticipate any impact with this transition on kind of how that the importance of teamwork and sort of cross-disciplinary collaboration. We don't anticipate any changes with this transition in that sense. Bill, was there anything you wanted to add here?
No, I think you covered.
Okay, sounds good. So that brings us to the end of the list of questions that you all submitted before our session today. We probably have 5, 6, 7 minutes if there are any questions from the audience that you'd like us to address. Yeah.
Well, my question obviously has to do with a legal perspective, that 100 years ago there was a proposal to move USD to Sioux Falls, and it had to be submitted to a statewide vote and was overwhelmingly defeated. Mm-hmm. Why was that different than now?
Oh.
That's a great question, Art. As with many things, I would start with money, right? Between what we have already invested in infrastructure in Vermillion and what we're about to invest in infrastructure in Vermillion, on just the academic side, so no athletics, on just the academic side, is going to approach $100 million over probably a 9 or 10 year period. We couldn't move it if we wanted to, right? I mean, we have invested heavily in reworking our buildings. Deferred maintenance and repair is a huge problem in public higher education across the country. It's not a problem here. And it's because of the kind of long-range planning that we've done, the deliberate investments that we've made. We've identified, when President Gestring started, we identified 4 major projects that really needed to be renovated and updated. And that would be South Dakota Union, which, if you haven't been through it, you should. It was gutted and completely redone. Churchill Haynes, which is in the process of being done right now. Dakota Hall, which is the subject of the most recent appropriation that we just received from the legislature, and East Hall. And the first floor of East Hall was done last summer, and then East Hall will come after Dakota Hall. After that, and then the demolition of Akeley Lawrence, and the plan there is not to replace that with a building, but to turn that into green space. After that, now we're back to, it's probably time to take a look at Old Main again, because it's been about 30 years since that was last touched. But the investment that we have in physical infrastructure alone means USD is here.
My question is, how are you going to continue the mission of the medical school to put out rural practice physicians when you moved the medical school from a rural area to a larger city, both larger cities?
Yep. So just to clarify, how will we continue to support rural?
Has always been to train rural providers.
Yep.
Yeah, we're going to get some that are going to go to big cities, but it's supposed to be making rural practitioners.
Yep. So that's a good question. Thanks for asking. So if any of you are not familiar with the FARM program, the Frontier and Rural Medicine program, this is a program that directly connects our medical students with 5 different rural communities throughout the state of South Dakota. No impact with the transition from Vermillion to Sioux Falls. In fact, there may be opportunities to even enhance some of those rural programming, that rural education experience that already exists across the state of South Dakota. Again, we're talking about transitioning just that first pillar. Pillars 2 and 3 are already in Sioux Falls, and we will remain committed to serving the rural health needs in South Dakota and beyond. This just again consolidates that education experience into one area as opposed to having our students commute back and forth as many of them do already. Anything anybody would like to add here?
How many students does the farm program actually train in a year?
You know, I don't know that
Who knows? It's not that many, because I've farmed students
15.
12 to 15.
We've
been, we've been contacted by other rural communities to increase student that come there, and that's being looked at right now, and it's a matter of whether they'll have enough physicians to support those students and mentor those students. The medical students go through a match program for where they want to go for their specialties or subspecialties. That won't be affected at all by the move of the medical school. We have students that go to, I've been here 10 years, and we have students that go to Boston and Houston and Omaha and Denver, so that won't be affected for the move to Sioux Falls. They will still have students that go to larger cities because the training of those students is outstanding, both from the basic sciences and the clinical aspects, so these students can match in outstanding programs. And to have a student from South Dakota have their diploma on the wall in Los Angeles and New York and Dallas is outstanding advertisement for our school, to be honest with you. But we will not ignore the rural communities.
Has there been any discussion throughout this whole process about moving the adjunct graduate programs like PA and PT and OT to Sioux Falls as well as the medical school?
So that's another good question. We are talking only about Pillar 1, the medical education, student affairs, and then basic biomedical and translational sciences.
We're currently working with the health sciences programs to make sure that the anatomy program stays here and we have educators for those programs. So we are in the process of hiring people, and so they will stay here so that they will help with the health sciences programs.
I'm a little bothered by your discussion of interdisciplinarity because it sounds to me almost like interdisciplinary within the sciences, and I'm concerned about the split between, you've heard of this before.
Yep.
I'm concerned about the split between arts and sciences, between things like history and economics and philosophy and languages and what have you, and the sciences, because I think that interaction is extremely important. And I guess I'd like to hear a little more about that.
Sure. No, that's a great question, Ray. One of the interesting things about big data, about AI in general, is just how interdisciplinary it has become very quickly. And if you take a look at our recent hires, you'll see that reflected. So my home department is history. We just hired, is now a second-year faculty member, Jeffrey Liu, who does some amazing data transformation work. We have started basically a digital humanities center in the library that is focused more on the humanities, but also the intersection of the humanities, AI, and big data, with the idea that that becomes a training ground for our faculty and students, including some library-specific projects that are focused on the humanities, but also providing that expertise out to other departments. If you were lucky enough to be at IdeaFest yesterday, there was a 2-hour session about the applications that our faculty have developed, how they have implemented things like AI and big data in their classrooms. And it was a range of faculty from all across the institution. And there is a lot of collaboration that is happening as people learn that, so-and-so in philosophy has this skill set, or, so-and-so in the School of Education has that skill set. There's a lot of commonality there that people are taking advantage of. The IDS will help us better do that in the STEM fields, but it's spreading everywhere.
And one of the 5 hires we are doing this year is in philosophy. That is a data science related hire, right? So we're going to have a philosopher teaching ethics of biomedical and data science issues, which is, I think, the opportunity that all of this emphasis on data provides to the humanities is, I think, something that we can lean into as a liberal arts institution. That is, in other words, here when you're studying data science right now, when you're in computer science, the required ethics course that they take right now is taught by someone with a PhD in philosophy, right? So that's something the other schools in our state can't say, right? And so that's something that we really want to lean into.
Yeah, one of the questions that we talk about when it comes to this general subject is it's not a question of can we do it, developing whatever the tech-related solution is. The real question for society is should we do it, and if so, how should we do it? And that's where the liberal arts come in, right? Trying to understand the implications of what it is that we're doing. If you take a look at a lot of federal grants and contracts right now, if you take a look at DoD grants, NSF grants, they're all asking for this infusion of the humanities into all of their AI and big data projects, simply because it's really a question of how does this affect society, how does it affect culture, and that's what the liberal arts is best suited to do, and that's what we're trying to integrate and create here.
Yeah, we'll do one more.
So I'm Dr. Quayle. I went to Augustana College 2001 to 2005, and during one of those summers, I did a brain scholarship down here. I didn't drive, so not everybody commutes, right? So I came here at one apartment for 3 months with Dr. Chaucy, and we had a great, I got published, I had posters, I went to University of Minnesota Medical School, and then I went to the Navy, and when I got out of the Navy, I was like, okay, I've been to Vermillion. I was there for a summer, and that was one of the major reasons that I came back, to South Dakota. So I just, not everybody commutes, and I know it's good for the state at the med school, of course, just going up to Sioux Falls, but it's hard to see sometimes how it's good for Vermillion. And that's a hard one, right? So, but I just wanted to give a quick case study as we're talking research. Thank you.
Thank you for that comment. I know we're at the end of our time here. I suspect there may be more questions. Happy to stick around and talk one-on-one if that would be of interest. But first of all, thank you for letting us join today. I know that there has been a lot of feedback, rumors, uncertainty around this move. We understand the impact, the feelings across the board that this has. But but more than anything, we want to assure those of you here today, and as you carry this message out, USD remains more committed than ever to the community of Vermillion. Dr. Hackemer talks about approaching $100 million in non-academic building investment, or non-athletics building investments. And then you add in all of the athletic facilities and programming there. We are invested in this community, and that will not change with this one program transition. The IDS opportunity is tremendous, and we now have a pathway to pursue that, and much more quickly than we might have been able to before. We know that program will not only bring tremendous value to our students, but by extension, tremendous value to this community, and we're excited to pursue it. Is there anything else that you all would like to share as closing comments? Okay, sounds good. Thanks again for having us. We'll stick around, but appreciate the time.
Just, if you want, you can stay right here. We just have a little closing thing. Of course, we have a 50-50